तो क्या है, बस चालू करना, सेशन चालू करना बाकी है। 10 मिनट में, आफ्टर 10 मिनट्स। यस, श्योर। या जस्ट
Hello everyone, this is from ICM. I hope you are able to hear me. We are waiting for the speaker, so it will take some time for us. The YouTube live streaming has been started, so those who are not able to join this, you can always see in the YouTube. And we are waiting for the main speaker. If there is any kind of questions, then you can always write in the chat box here. Hello. Yeah, Dr. Gagan, you there? Hello, Dr. Gagan? Hello, Dr. Gagan? Hello. So we are just waiting for some more people to join because lots of people are there in the waiting room. So we will wait for a little bit time when I connect with Dr. Gagan. And the main moderator of this session, Dr. Ashish Kumar Gupta and Dr. Sankalp Jha, they are in the health camp now. From health camp is going on from National Medical Association. So they are on field. They are participating.
Good morning, everyone. Warm welcome to everyone. This is Dr. Gagan Kumar Banode. Treasurer, Indian Society of Sports and Exercise Medicine. Hello, madam. I can see Dr. Rachana, madam. So we are here to start our session on clinical exercise physiology. And for introducing the topic, I will invite Dr. Dobson Dominic to introduce the clinical exercise physiology topic. Over to you, Dr. Dobson Dominic, sir. He is the current president of ICCM and head of Department of Sports Medicine, Savita Medical College, Chennai. Can you hear me, sir?
Yes, we can hear you, Dr. Gagan. Good morning.
Good morning to all. Thank you, Dr. Gagan. Greetings from Indian Society of Sports and Exercise Medicine. It is my pleasure to invite everyone for this wonderful occasion of webinar on online lecture and panel discussion on the role of clinical exercise physiologist in the Indian context. So, from Indian Society of Sports and Exercise Medicine, we are very happy to host this important meeting. And special thanks to Mr. Nathan Reeves, the main person, director of International Confederation of Sports and Exercise Science Australia. Thank you, Mr. Nathan. And we're also happy to have Dr. Atharva Dole for having the session on exercise medicine. So this is going to be a important chapter with the advent of so much of incidence of non-communicable diseases and lifestyle disorders. This one area, clinical exercise physiology, is probably the need of the hour. Right now, in the Indian context, it's more of either an exercise physiologist or the MD physiology. And the role of clinical exercise physiology in the Indian context has to be explored. That is where the Indian Society of Exercise Medicine has championed this cause, and we are delighted that we are going to sign a MOU with the International Confederation of Sports and Exercise Science to bring clinical exercise physiology to India. Thank you, one and all, the senior faculties, all the clinical exercise physiologists. Let's hear from the expert speakers and followed by the panel discussion. Thank you.
Thank you, Dr. Dobson Dominic, sir, for introducing the topic. Now I'll introduce our first speaker, Dr. Atharva Dole. So basically, he is an accredited exercise physiologist. He's a master's degree in exercise physiology from University of Sydney, Australia, and BHM from Bharati Vidya University. He leads BYAIAM Exercise Physiology Clinic in Pune and also worked at Foster Private Hospital, W. Australia. His expertise spans clinical assessment and evidence exercise, respiratory, neurological, and musculoskeletal conditions. He has a strong focus on geriatric care, post-operative rehabilitation, and improving motility, strength, and functional independence. Dr. Dole is in functional testing, including VO2 max strength and response monitoring, and integrates exercise therapy with holistic care for long-term health outcomes. He is also engaged in academics as guest faculty at Ferguson College of Physiotherapy and has been invited as a speaker at Modern College of Physiotherapy, both physiotherapy college. So I welcome you, sir, from the team of ICCM, and welcome to talk on clinical exercise physiology. Now you can start your session, sir. You can unmute yourself, sir.
I'll just share my screen and for you to just see the slides first.
Sir.
Are you able to see the slides, sir?
No, sir. No, we are not able to see, sir.
Sorry, just give me a minute.
So if there is any kind of issue, technical issue in sharing a slide from your side, you can always share the PPT to us so that we can present from our side also, if there is the problem, sir.
Sure. Should I just send the slides across to you, sir?
You can share in the WhatsApp group, so we will try to present from our side.
Okay, sure. Yes. Yes, I've sent the slides, sir.
Sure, I have received the slide.
Yes.
So let me try from my side.
Okay, thank you, sir. Can everyone see the slides now?
Yes, sir.
Yes, sir.
All right. Sorry for the technical delay. Thank you for the wonderful introduction. Yeah. So, good afternoon, everyone. It gives me immense pleasure to present before you today. I would really, first of all, like to sincerely thank the president of ISEM, Dr. Dobson Dominic, as well as Dr. Professor Sharma, as well as Dr. Professor Sankal Jha, for giving me this wonderful opportunity. Your vision and commitment to advancing sports and exercise medicine in India have created a strong foundation for discussions like these. I would also like to acknowledge Mr. Nathan Reeves. I initially contacted Nathan a couple of months back, and he was readily on board to help us develop this faculty in India. We had really thoughtful discussions and collaborative spirit, and it has truly set the ball rolling for clinical exercise physiology in India. His international perspective, combined with the Indian society's leadership, has given us a direction to imagine how this profession can be developed and recognized in our country. This moment is special because it brings together leaders, educators, practitioners, and students, all of us united by a common mission to reduce the burden of lifestyle diseases and to promote healthier living through structured evidence-based exercises. Having worked in Australia, I have seen firsthand how a multidisciplinary model where exercise physiologists, physiotherapists, rehab consultants, nutritionists, occupational therapists, speech therapists collaborate and together transform the patient outcomes. The power of this integrated approach is something which India urgently needs. And today I'm excited to share these insights with all of you. Today, together, I believe we can take the first steps towards building a healthcare revolution in India where exercise is needed not just as fitness, but as a medicine when prescribed precisely. And each of you here today has a role to play in making this vision a reality. Can we move to the next slide, sir? Thank you. So, imagine for a moment that a new drug has been developed. Its clinical trials show that the risk of cardiovascular disease is reduced by 40%. It cuts the risk of type 2 diabetes by almost about 50%. It's a powerful antidepressant and it has proven to reduce mortality from certain cancers as well. It improves your cognitive function, improves your sleep quality. It has virtually no negative side effects and actually makes every other treatment very effective. And what if I told you this drug already exists? It is not a pill that you swallow, but it is a simple protocol that you can follow. This effective pill can be called as clinical exercise physiology. The next slide, sir. The answer to all of this is clinical exercise physiology. We will take a look at what exactly the clinical exercise physiology part is, and we'll introduce how the Australian aspect or how the outlook of Australia is with this. Yes, the next slide, please. With clinical exercise physiology, you all know it is the science of defining the dose, intensity, and the frequency of exercise to manage and prevent disease. Whenever I see patients in my day-to-day practice, most of the patients, when I ask the person what kind of exercise do they do or what kind of any kind of activity that they do, most of them are unable to describe what intensity they actually do exercise at. It is very important for us to educate the patient about how exactly or what kind of intensity frequency for the exercise could be. Next slide, please. If we were to just compare with the medical aspect, the pharmacology of exercise prescription, in pharmacology, we obsess over precision. We talk about a drug's mechanism of action, its bioavailability, its half-life, its therapeutic window. We meticulously calculate the dose to maximize the efficacy and minimize the toxicity as well. Now, what if we apply the same rigor to a different kind of intervention? What if we say that we can apply the same aspect to exercise as well? For example, what is the mechanism of action of high intensity interval training on insulin sensitivity? Or what is the therapeutic window for resistance training in cardiac rehab patients? What is the optimal dosing schedule for aerobic exercise to manage hypertension? The question is no longer if exercise works. The question is how to prescribe it with the same scientific precision as a pill. The answer to this discipline is clinical exercise physiology. The next slide, please. So, clinical exercise physiologists, or in Australia, are also called as accredited exercise physiologists. So I'll go through the journey or how the pathway in Australia is, and we can just wonder and we can discuss in the panel discussion if we can create a similar pathway in India as well. So according to Exercise and Sports Science Australia, exercise physiologist can be described as a person who prescribes, delivers, and adapts movement, physical activity, and exercise-based interventions to facilitate and optimize health status, function, recovery, and independence. These interventions help individuals participate more fully in activities at home, school, work, and also in the community. Exercise physiologists can use exercise as a form of medicine. They can design, deliver, and adapt exercise interventions to manage a broader range of health conditions. They can also work with clinical population as well. The focus is on individuals with or at the risk of medical conditions such as cardiovascular diseases, diabetes, osteoporosis, depression, cancer, and chronic pain. So you all know that exercise has effect on multiple aspects. We'll just look at the next slide to just see what the scope of an exercise physiologist is. Like I said previously, you can, with exercise physiology, you can safely prescribe an effective exercise program which is completely evidence based with all kinds of acute, subacute, or chronic medical conditions, injuries, or disabilities. We can manage various medical conditions along with we can manage various medical conditions with exercise prescription, which includes cardiovascular, metabolic, neurological, musculoskeletal, even some kinds of cancers, kidney diseases, and mental health issues. A research by Booth et al. In 2012 revealed that a lack of exercise is a major cause of around 35 plus chronic diseases. Next slide, please. Now, we will just compare what three roles or what three fields which are a bit overlapping but have a distinct role in itself. For example, a clinical exercise physiologist uses exercise as a clinical intervention to manage and prevent chronic diseases and complex medical conditions. At the same time, sports science aspect will apply the scientific principles to optimize the athletic performance, enhance training, and also prevent injury in healthy or elite population. Also, the most overlapping or the most commonly sought field right now, physiotherapy, focuses on diagnosing and treating acute injuries, pain, and movement dysfunction. It is often through manual therapy alongside corrective exercises. In the next slide, we will compare an accredited exercise physiologist with accredited exercise scientist and a personal trainer as well, just for us to identify the role and what exactly how we can differ with each other. Next slide, please. So, clinical exercise physiologists are healthcare professionals and who are specialized in prevention, treatment, and management of chronic diseases. They use evidence-based prescriptions, monitor vital signs, adapt programs to individual medical needs, and reduce the risk of exercise-related complications. In some healthcare systems, their services are covered by Medicare or insurance, showing their recognition as a part of mainstream healthcare. Accredited exercise scientists primarily work with athletic population which focus on performance, their fitness, and overall well-being. Personal trainer, on the other hand, do not require a formal degree as such, but work with low-risk clients and focus mainly on general fitness. They are certainly important in our society to promote physical activity. Personal trainers' focus is mainly on strength, endurance, and performance for people who are generally healthy. However, they are not as such trained to manage complex medical conditions. Next slide, please. So let us move on to the topic why exercise can be considered as medicine. So this is a movement which is pretty much followed in Australia since last many years. So many researchers have shown that exercise reduces your HbA1c, even reduces your hospital admissions considerably. When we say exercise is medicine, it is not just a slogan, it is science because there are plenty of evidence behind it. It can actually reduce the use of long-term need of medication which saves cost as well as side effects. Exercise strengthens the body from within and add years to life and life to years as well. So very important aspect in this is for a person or a patient to have a good quality of life and also maintain the independence in their daily activities. By moving regularly, we can prevent serious complications of chronic diseases. Heart attacks, strokes, diabetes flare-ups, all can be reduced with the regular right amount of exercise and the right prescription of exercise. It is not just not effective on physical aspect, it is also effective in the mental aspect as well. It uplifts your mind and your mood significantly. It lowers your sleep, it lowers your stress, improves your sleep, and also naturally boosts your confidence. Think of it as a prescription without any expiry date. Truly, exercise is the most accessible, affordable, and effective medicine that we have currently. Next slide, please. So, if we were to consider the scope of practice and were to consider the Australian example, in Australia, accredited exercise physiologists have a wide and respected scope of practice. They are an essential part of hospital-based teams supporting patients after surgery or injury or chronic illnesses. They work alongside doctors, specialists, ensuring exercise prescription is safe, tailored, and also evidence-based. Exercise physiologists can also lead diabetes and obesity management programs, helping patients control their health beyond medication. In Australia, these services are covered by insurance and government schemes like Medicare, Work Cover, and the NDIS, which is the National Disability Insurance Scheme, which highlights their recognition as allied health professionals. And their role doesn't just stop in hospitals, they extend into corporate wellness programs and community health services as well, promoting prevention as much as treatment. In short, exercise physiologists in Australia work across the entire spectrum from rehabilitation to prevention and from clinics to the community. Next slide, please. Now, let us look at the pathway or the career outlook in Australia. So, to become an accredited exercise physiologist, there is a clear training pathway. It begins with bachelor's in exercise science, which is usually for 3 years, which builds your scientific foundation and basic topics. Then comes master's in exercise physiology, which is 1 or 2 years of advanced clinical training. Alongside, students complete extensive clinical placement in hospitals and community health settings, working with patients. After meeting all the academic and the practical requirement, they apply for accreditation with ESA, which is the professional body, Exercise and Sports Science Australia. And the learning doesn't stop there. Every year, they must engage in ongoing professional development to stay updated with the latest evidence and practices. This pathway ensures the exercise physiologists are highly skilled, safe, and recognized as allied health professionals. In the next slide, we'll look at how exactly they are divided with the practical aspect as well. Can we have the next slide, please? So we spoke about the training pathway in Australia with the bachelor's and the master's, along with the essential is the accreditation with ESA and then the ongoing professional development. Next slide, please. So with the practical standards, ESA has a minimum of 500 practical training, which is 140 hours of exercise science, which is essentially what I did was with the healthy population, and 360 hours of clinical exercise physiology, essentially based in clinical setup where I was working with a lot of patients. First aid, CPR, and indemnity insurance is required, and continued professional development 20 points per year is mandatory for the practical standards. So in Australia, exercise physiologists are not just fitness experts, they are fully recognized allied health professionals. These services are funded under Medicare and also covered by private health insurance, making them accessible to patients from all walks of life. Doctors regularly refer directly to clinical exercise physiologists. So in our hospital setting, we often used to give a report back to the general practitioner or the specialist who the patient was under. And this builds a good rapport with the patient and with the doctor for regular patient referrals, and it also helps as the medical part is covered by the doctors as well. Today, there are over 6,000 accredited exercise physiologists practicing across Australia in hospitals, community clinics, and private practices as well. Importantly, they stand on equal footing with other allied health providers like physiotherapists and dietitians working together in an integrated healthcare system. The recognition highlights the maturity of the profession in Australia and the critical part it plays in the healthcare delivery. Next slide, please. I'll just briefly touch base upon how, next slide, please, sorry. I'll quickly touch base on my journey in Australia. To be very honest, when I first went to Australia, my main interest was working with the athletic population. I was fascinated by fitness, performance, and sports science aspect. But during my conversation with the professors and through clinical placement in hospitals, I witnessed the potential exercise has in healthcare. I saw patients with chronic diseases, post surgery weakness, or age related decline tremendously benefit from structured exercise program. Helping a patient walk again after a stroke, seeing improvement in heart failure patients, or even help someone regain confidence after COVID 19, that sense of satisfaction and impact was far greater than simply enhancing athletic performance. This experience changed my perspective, shifting my focus from performance to prevention and rehabilitation. And that is why I feel India needs clinical exercise physiology even more urgently. With the rising rate of diabetes, heart disease, obesity, and cancer, the need is massive. What I experienced in Australia, an integrated healthcare system where clinical exercise physiologists, nutritionists, doctors work together, is something India must adopt. Bringing these lessons home is not just my career path. I try to make it my mission. Can we have the next slide, please? So, right when in Australia, I worked in a hospital called Foster Private Hospital, and very essential part of the team was a multidisciplinary teamwork for patient care. And this holistic, efficient, and patient-centered care was extremely effective in the patient's overall outlook and overall.
I think we have lost the speaker, so we will wait for some time. Atharva Dole, Dr. Atharva Dole, you are there?
I think some network issue is there. We will wait.
So we will wait for some time. So in the meantime, up to now, if there is any kind of doubt or any kind of questions, if any of the participant, especially the panelists, want to ask, you can just unmute yourself and you can do it. Till the
Dr.
time of
Babu?
our speaker. Yes.
Yeah,
Yes, please.
Dr. Udati this side, thank you very
Okay.
much for inviting me to be a panelist here.
Okay.
So
Okay.
I
Thank you,
just
madam.
wanted to, since you have such a vast experience in this field, and you have done specialization both in exercise physiology as well as physiology. So can you inform the audience about all the ways in which in Indian system people can find jobs in this domain, and also how we can like collaborate and advance this field?
Yeah, sure. So until our main speaker, so I will just highlight the importance of the exercise physiology. And the clinical exercise physiology, as already highlighted here, plays an important role, especially in the condition where non-communicable disease is increasing at a pandemic level. So we have two problems. One is increasing sedentary activity. For sedentary activity, we have to improve, increase participation in different type of physical activity. And another is along with that sedentary activity, there is also increase in activity-related injury and illness. That's why sports medicine and exercise physiology, clinical exercise physiology, both are required. So regarding
He's here.
Sorry, can you hear me?
Yeah. Please continue.
Sorry, I lost the connection. Sorry. Can we have the next slide, please? Can you hear me, sir?
Yes, sir, we can hear you.
Okay, can we have the next slide, please? Yes. Sorry about the connection. I'll just continue from where I left. India's health crisis, we all know about what exactly is happening with the situation right now. India is totally standing on a critical health crossroad where we are called the diabetes capital of the world with 100 million people living with diabetes, a number projected to rise to 134 million by 2045. So that's a staggering number. But diabetes is just one part of the picture. A staggering 66% of deaths in India are caused by lifestyle related diseases such as diabetes, heart disease, and hypertension. We are seeing an alarming rise in heart disease, COPD, obesity, and high blood pressure conditions that rob people not only of their health but also of their productivity, independence, and quality of life. Adding to this crisis is the lack of physical activity as well, with most people either not exercising at all or lacking the motivation and guidance to start. The sedentary lifestyle is fueling the rapid growth of these diseases. This crisis is not limited to just hospitals, it's community-wide challenge affecting families, workplaces, and the nation's economy as well. And unless we act now, the burden will only grow heavier in the coming decades. But the good news is that many of these diseases are preventable and manageable through the right lifestyle intervention. This is where clinical exercise physiology and evidence based programs can play a transformative role. By focusing on prevention, rehabilitation, and sustainable lifestyle change, we have the opportunity to rewrite India's health story. Can we have the next slide, please? So the question arises, and why we all are here today, is why India actually needs clinical exercise physiology. India is facing a silent health crisis driven by chronic diseases. Doctors play a crucial role in diagnosing and treating acute medical illnesses. However, once the immediate problem is stabilized, patients are often left with limited guidance of how to manage their lifestyle for long-term health. This is where a clinical exercise physiologist can step in. Physiotherapists who mainly focus on musculoskeletal injuries and rehab can also help the clinical exercise physiologist to train and design safe evidence-based exercise program, or they bridge the gap between doctors and patients by providing structured, personalized rehab and preventive care. By empowering patients to take control of their health through exercise and lifestyle modification, clinical exercise physiologist not only improves their recovery but also reduces the risk of disease progression. In a country like India, where lifestyle diseases are on the rise, clinical exercise physiology is an essential need for a healthier future. Now, if we were to consider, can we have the next slide? Now, if we were to consider the benefits of CEP for India, if we consider the patient aspect, definitely with chronic diseases such as diabetes, heart disease, they can take control of their health with safe and effective exercise program. Also, with the exercise, it will improve their quality of life, give them greater independence, and reduce reliance on medication. Regular supervision also will lower the risk of complication, give patient the confidence and in managing their own conditions. Benefits for the healthcare system, if you were to consider, Indian hospitals are already burdened with rising lifestyle diseases. Clinical exercise physiologists can help reduce hospital readmission by providing structured rehab and preventive care. This means fewer relapses and fewer further admissions in the hospital. It will reduce the long term treatment cost and it will also help us better use of the healthcare system. It is an important part of a system for doctors, physio, nurses, and ensuring holistic care. If you were to consider the benefit for students and professionals, it is a pioneering career path in India. It is an upcoming career path. Now, with global recognition and growing demand, students entering this field will be at the forefront of healthcare revolution. This will not only create a career identity but also contribute directly to solving India's lifestyle disease crisis. Hospitals and rehab. Now, where students can find the job opportunities are in hospitals and rehab centers, then also diabetes and obesity clinics, even corporate wellness programs, research and academia, and there is obviously the global pathway where you can also pursue your masters in a foreign university, which can also give you a great outcome. For society, a healthier population leads to greater productivity, reduced healthcare expenditure at your family level, and overall economic benefit as well. So by preventing disease progression, CEP is help, help build stronger and more resilient communities. Can we have the next slide, please? So the future of CEP, let's consider a few researches for impact in India as well as globally. Pre-diabetes remission in India, a study by Freedom from Diabetes Institute, which is based in Pune, involved 427 pre-diabetic individuals aged around 18 to 75, revealed that a one-year integrated lifestyle program combined with diet, exercise, psychological support, and medical oversight, can call as a holistic approach or an integrated approach, resulted in 47.1% achieving pre-diabetes remission. And additionally, 34% of participants lost over 10% of their body weight. Aerobic training lowers blood pressure. So, a systematic review of 24 Indian studies found that aerobic exercise reduces systolic blood pressure by 5 and diastolic by 3.1, meaningful reductions given the high cardiovascular disease risk in this kind of population. Can we have the next slide, please? At the global level, reduced hospitalization in heart failure patients. A meta-analysis across 61 randomized controlled trials on heart failure patients found that exercise training improved health-related quality of life and reduced hospital admissions, especially in patients with preserved ejection fraction. Can we have the next slide, please? Now, let us look at a case study. So it was, sorry. Yeah. So let us look at a case study which I saw in the Foster Private Hospital. When I was doing his initial assessment, the person said that his birth year is 1924. I couldn't believe that a person sitting in front of me was 100-year-old. When I spoke to him, he was a World War II veteran as well. And it was incredible to see him so active, so physically able to do all kinds of things on his own pretty much. He was admitted in the hospital post COVID-19 and just for severe deconditioning, reduced exercise tolerance, low oxygen saturation, and unstable blood pressure. Despite his age, he was a regular gym goer prior to his illness, highlighting the role of lifelong exercise. Can we have the next slide? So we'll just look at the outcomes of what pre-admission and post-admissions outcomes he had. So initial assessment, when I did the pre-assessment, pre-reconditioning program, you can see the SpO2 at rest was 91%. The blood pressure was around 150 or over 95. When we did the 6-minute walk test, it was 120 meters with fatigue, and it actually required breaks for him. He was walking with a walking aid. He was using a four-wheeler walker just to support his walking as he was unable to walk for longer distance. When I did the 30-second sit to stand test with him, he just could manage 4 repetitions. His functional status, he was dependent for mobility and fatigued with daily activities. In Australia, where I was working, this scene with this area was particularly a retirement town for people. So this patient here don't living with the living independently and able to do the independent activities by himself is very important in their context. Post reconditioning, after 8 weeks, we can see significant improvement in the SpO2, which was maintained at 96%. Blood pressure was 152, which was better regulated. 6-minute walk test, I was impressed when I saw that it had improved considerably for 280 meters and actually without no breaks. 30-second sit to stand was 9 repetitions, which is also a very significant lower limb strength gain. He became independent in his mobility, so he is walking without any aid. He just carried a walking stick if he need to balance himself, and he resumed light gym-based exercises. Funnily enough, we went to the same gym in the town, and I met him at least 3 times a week. So when I first did his initial assessment, he had asked me to write an email to the gym saying that I won't be able to attend the gym because I am admitted in so and so hospital. So such was his dedication, and such was his he was very keen on exercising. Can we get the next slide, please? So a few key takeaways. At 100 years of age, this patient shows remarkable recovery with evidence-based, close monitor clinical exercise physiology intervention. His story is a proof that exercise is effective at any age. It provides safe, measurable, and life-changing outcomes even in high-risk population as well. A holistic team-based approach, exercise physiologist plus a physio plus rehab consultant plus nutritionist is vital for success. At 100 years, recovery is possible. Exercise is not just for the young, it is medicine for life. We can see the picture of him, and he was doing everything by himself while we discharged him. Can we have the next slide, please? So let us come to the main topic and what we are here for today with the panel discussion as well. So what do you feel is the future of clinical exercise physiology in India? With the rising burden of non-communicable diseases like diabetes, heart disease, and obesity, there is a huge demand for safe, evidence-based exercise intervention. When it is supported by societies like Indian Society of Sports and Exercise Medicine and guided by successful global models like the International Confederation of Sports Science Practice, exercise physiology is gaining visibility and credibility. Over the next decade, clinical exercise physiologists are expected to achieve a level of recognition comparable to physios, becoming a standard part of the healthcare team. As India grapples its way through the non-communicable diseases epidemic, if I may call it, clinical exercise physiologists will be at the forefront of preventive healthcare and rehab. Their role not only eases the burden on doctors and hospitals, but also empowers patients to take charge of their health and ensuring better long-term outcomes. In short, the future of CEP in India is one of the rapid expansion, strong demand, and increased recognition of profession whose time has certainly come. Can we have the next slide, please? Now let us look at the current gaps in India. There is no formal recognition, so clinical exercise physiologists are not yet formally recognized as a part of professional workforce in India. Without official inclusion, Their services lack structured acceptance and coverage. There is low awareness, so most doctors, patients, and the general public are not aware. So, whenever a person visits me in the clinic, most often I'm confused with a physio or a personal trainer. So, there is low awareness about what exactly the role is. The role confusion, and there is an overlap of what role can each faculty can do. We are mistaken as physios, gym trainers, or sports coaches, and this overlap just creates confusion and dilutes the unique identity of clinical exercise physiologists. There is no standardized education pathway yet. India does not have a clear academic pathway, accreditation body, or a licensing system for clinical exercise physiologists. This makes it difficult to maintain quality, credibility, and consistency in training. Also, limited career opportunities at the moment with no formal recognition or established pathways. Very few positions in hospitals, rehab centers, or sports institutes, and even limiting professional growth and patient access. I'm sure in the coming future, there would be plenty of opportunities and um, plenty of stuff that clinical exercise physiologists can work in. Can we have the next slide, please? So the question is why we need an organization. So when you define the scope of practice, an organization clearly outlines what an exercise physiologist are trained to do and where they differ from a physio, a gym trainer, or a sports coach. This helps create a unique professional identity and avoids role confusion. Education plays a very important part. By spreading awareness, the organization can ensure the doctors refer patients to CEPs. The public understands their value, and policymakers integrate them into healthcare system. Professional legal and medical legal aspect is very important as well. A governing body can ensure that we have a strict guidelines, maintain professional standards, and have legal backing for their practice, safeguarding both patients and practitioners. India has unique health challenges such as diabetes and heart disease at younger ages. An organization can drive research tailored to these needs and develop India specific exercise protocols as well. There is an also opportunity to align with global standards such as ESA, which is Exercise and Sports Science Australia, the ACSM, which is the American College of Sports Medicine, which already regulate and advance this profession. An Indian organization would allow clinical exercise physiologists to align with these global benchmarks, ensuring credibility, recognition, and opportunities for international collaboration. Can we have the next slide, please? Also, there is a need for educational standards as well. For professionals, credibility, there should be a clear career pathway, professional community for each other to help us in our need. For patients and clients, safe evidence based exercise guidance. And for healthcare and sports, trustworthy professional are also to improve your health outcomes. Can we have the next slide, please? Now, if we were to consider the need for educational standards, there is a huge variability in current courses. At present, exercise and fitness related courses in India vary widely in quality, content, and depth. Some focus only on fitness training, while others touch base upon clinical care, leading to inconsistency and confusion. There should be a standardized core curriculum, which is essential to ensure that every exercise physiology graduate with the same scientific foundation in anatomy, physiology, pathology, and exercise prescription. There should be a clear competency which will guarantee that graduates are just not knowledgeable but also skilled and safe in applying exercise intervention in clinical population. There should be clinical hours and practical training at hospitals, rehab centers, even sports clinics is very critical. Supervised clinical hours will ensure students gain hand-on experience before the independent practice. A national certification process will establish credibility, regulate the profession, and prevent unqualified individuals from claiming to be exercise physiologists. Also, with strong educational and certification standards, Clinical exercise physiologists can be effectively placed in hospitals for patient care, in corporate wellness programs to reduce employee health risk, and in sports settings to optimize performance safely. Can we have the next slide, please? Now, we just consider quickly the lessons for India in this. So, we definitely need a structured accreditation system to ensure only qualified professionals are recognized as clinical exercise physiologists. This will standardize the process and improve the credibility of the individual as well. Ensure clinical exposure in hospitals, rehab centers. Supervised training can be really beneficial and can boost the confidence of all the individuals. There should be a recognition in the healthcare system as well to be effective, and also there is clear role definition. This will allow the integration into the hospitals, insurance system, and multidisciplinary teams quite easily. Now, using ESSA as a model of, have proved a successful global framework. India can adopt a similar local model which can build its own accreditation and regulation system. Also, when you consider governance and leadership through the International Confederation of Sports and Exercise Science Practice, Nathan is certainly on board, and we can definitely take his expertise and take his help in this program as well. Establishing accreditation, a formal recognition, is very important, which then can be trusted by doctors, even patients, and even policymakers, which can also protect the profession from unqualified claims. Now, lastly, a strong professional body is needed to represent clinical exercise physiology nationally, advocate for policy inclusion, and ensure that a profession's sustainable growth in India. Next slide, please. So I'd like to conclude, exercise is not just for fitness, it is a medicine when prescribed precisely. Clinical exercise physiology is already respected and established across the world, and India cannot afford to stay behind. With the rising epidemic of life diseases, the need is urgent. The students and professionals stepping into this field are not just learners, they are the pioneers of the healthcare system revolution that will redefine prevention, treatment, and long term wellness for our country. I believe together we are not just shaping careers, we are shaping the future of healthcare in India. All right. I'd like to conclude the seminar. Thank you everyone for, these are a few references, and thank you for attending this seminar. There were a few technical glitches, but we have gone through them, and now I'll just hand over to Dr. Gagan.
Thank you so much, sir. It's an enlightening talk on CEP, and we have so many questions by our participants. They wanted to ask so many questions about CEP and establishment of CEP in India. So basically, we will take up questions after we'll start the panel discussion. I'll move on with our next speaker, is Mr. Nathan Reeves, Director and Company Secretary, International Confederation of Sports and Exercise Science Practice, Victoria University. Just speak in brief about the CEP, sir. Can you speak a little brief about CEP before we go into the panel discussion? Mr. Nathan Reeves. Can you unmute yourself, sir?
Yes, can you hear me okay?
Yes, we can hear you, sir. Very well.
Good afternoon, or I think it's maybe just about to tick over into afternoon there in India. Firstly, let me acknowledge and appreciate the invitation by SISSEM to be able to attend today, and also a great acknowledgement of Arti in his presentation. He's given a magnificent insight into his personal journey to clinical exercise physiology and the impact that he's currently having in many people's lives through the modality of exercise. As has already been suggested, I'm a director on the International Confederation of Sport and Exercise Science Practice. I'm a clinical exercise physiologist by trade and an academic and also practitioner in Australia. I have the current privilege of working with many countries around the world as they progress their journey through to clinical exercise physiology. In some countries, there is an established workforce in clinical exercise physiology, and the International Confederation has been able to further enhance the skills and capabilities of practicing clinical exercise physiologists in an effort to gain greater recognition and access to systems that will fund and support the services provided by clinical exercise physiologists. I am currently working with a number of countries, including Turkey, Spain, Greece. I'm also working with Fiji, more recently Hong Kong. So there's a number of countries around the world that are on the very early stages of their journey through to clinical exercise physiology, perhaps not that dissimilar to India, with the similar aspirations and goals and potential challenges and difficulties with as India may face in the period ahead, and as Arti has challenged us all with. I'm certainly happy to answer any questions from the audience. I've posted a number of chat responses there to some of the questions that have come through with position statements and clinical guidelines from Exercise and Sports Science Australia, of which I am a past president and current chair of the Standards Council, the Professional Standards Council of ESSA. And I've also provided some links to the International Confederation's website, LinkedIn page, and also the World CEP Day, which is coming up in a couple of weeks' time. I too share similar sorts of views and thoughts to Arti in that I think the success of developing clinical exercise physiology in India is predicated on three key areas. Firstly, a professional association or advocacy body that advances the interests of its constituents and promotes the impact and the efficacy of services that are provided by exercise professionals in the clinical space. I think the second pillar needs to be focused around professional standards that underpin education and ongoing professional development for clinical exercise physiologists. And third, and certainly not the least, is regulation. Now, regulation is important to set the benchmark and to maintain that rigor and governance around the practice of clinical exercise physiology in your country, just as it is in my country, in Australia, and many other countries around the world. So they're the three things that I am assisting countries and regions around the world to develop so that they have a strong and robust and durable CEP workforce into the future. Thank you for the opportunity to briefly introduce myself, and I share the passion of many people online and look forward to working with you in the period ahead. Thank you.
Thank you so much, sir. It's a privilege to have you with us. Now we will start with our panel discussion, and before starting the panel discussion, I'll introduce our speakers of panel discussion, our panelists. So I'll start with the first panelist. Dr. Varun, can you please share the slide? Your list of panelists over here. So is Dr. Archana Agrial, madam. She is a professor of physiology at KGMU, Lucknow. 5+ years of teaching and research. Areas include exercise physiology and lifestyle diseases with a strong focus on pro-medicine. Welcome, madam. She's with us right now. And our second panelist is Dr. Suchet Trigotra, madam, with whom I have already done a CME, and is working as a professor and head of physiology department at the BR Medical Sciences Mohali, and she's a life ICM and organized CME on critical exercise physiology for health and sickness under the aegis of ICCM and SPCM number 23, where I was the part. She has done postgraduate diploma in bioethics from PhD Institute of Medical Sciences, Coimbatore. Our next panelist is Dr. Avinash and English, professor of AIMS Raipur. I have also worked with him when I was in AIMS, and he has a total teaching experience of more than 24 years and worked as an intensivist for 10 years. He has also worked in the medical education, working on some teaching, understanding, and research in physiology. And next is our Dr. Praful K, additional professor, AIMS Bibinagar. He has shown us. I will request all the panelists and please all the members to mute yourself. Our next panelist is Dr. Praful K, additional professor, AIMS Bibinagar. And he actively participates in various development programs, showcasing his dedication to lifelong learning and professional growth. Having completed his MD in sports physiology, he is an avid worker in the field of sports and exercise physiology. Next panelist is Dr. Arni Das, an associate professor in Gorakhpur with research interest in work, sleep, and cognitive performance. He has authored multiple systemic reviews and meta-analysis on related outcomes and neuropsychiatric disorders. He is also actively engaged in medical education and academic development. So I must tell you all that we were all together at Arnida, Dr. AIMS New Delhi. Dr. Rudri Gupta is an associate professor of physiology at Jammu. She has completed her MD physiology from AIMS Delhi with her research focusing on clinical neurophysiology and intraoperative neuromonitoring. She has presented her work at leading conferences including 2024. Our next panelist is Dr. Sudan, Associate Professor, AIMS Madurai, MD Physiology, worked in CPET, put a prime on CPET, interested in functional corrective exercise and lifestyle management. Next is Dr. Harpreet Kaur, Deputy Registrar, KLE Academy of Higher Education and Research, Associate Professor, Department of Physiology, DN Medical College, Director, Wellness Center, Belagavi, Executive Editor, Indian Journal of Health Sciences and Biomedical Research. So these are some of the panelists of our today's discussion. If I miss someone, please join the panel discussion. So now we will start the panel discussion. We'll start with our senior most, Dr. Archana, madam. You can start the panel discussion, madam. So you can start with like what is the clinical exercise physiology and what is the position of clinical exercise physiology in India, as you have already like done so much work in exercise physiology. You can start it, madam.
Thank you, Dr. Gagan.
Basics.
I'm honored to be here as a panelist. In my view, first thing is awareness and wish to do something for the nation. As per NMC norms, as per NMC guidelines, in all medical colleges, exercise physiology lab is there, right? So if you are having exercise physiology lab, you can do anything from there. Like in KGMU, I run exercise physiology lab is for research and fitness awareness program. Soon we are going to start value-added course on lifestyle management. Also work with family medicine and in collaboration with other departments also. So like in fitness awareness program, we test happiness index, DAS 21 scores, and short physical performance battery, and other anthropometric and other tests also. So being a physiologist, we can do anything if you are in a medical college. So exercise is a medicine. very well. All concepts are very clear now. So we can provide exercise dose to the needy persons. So in India, it's in the initiative phase mainly. As per NMC, and NMC has given has added this in the curriculum. So we can do in collaboration with other. We can set the run the special programs for the community also, and with other departments like psychiatry, sports medicine, family medicine, community medicine. We can work with them.
Thank you so much, ma'am, for your insights. Now I'll ask our next panelist, Dr. Sujit Ligotra, madam, to speak on CEP in India. What is the current scenario, madam? You can speak. What is
Okay,
going on? Yes.
good afternoon, Dr. Gagan. Thank you for giving me this opportunity. And I think physiologists have great role in this clinical, exercise physiology. And when I became a member of ISSEM and started listening to the videos of Dr. Barun and you, and then we thought of organizing one CME, as you were very active part of Dr. Gagan. I must thank you for that. So then in detail, we learned about exercise as medicine. It is actually a medicine that Dr. Atharva Dole has also explained very nicely. So I think as physiologists, we have got a very major role in spreading this awareness as an important role of exercise in um, and the physical fitness in actually the various diseases and prevention of diseases and all. And as such, you like our college is only a budding college, only 4 years old college. So we have not started the lab yet, but we are thinking of starting the exercise physiology lab for the, because we are planning to start the MD course also. So there I am planning to start exercise physiology lab where we can collaborate with department of medicine, orthopedics and all, and we can actually prescribe exercise as medicine. And but I think the awareness and the training is must for all the physiologists if we want to give that service to all. So that is also very must. And I congratulate ISSEM and other societies who are spreading this awareness of clinical exercise physiology. And I congratulate you for launching this program. And I think one platform should be there where we can also approach you to for the guidance, so proper training and guidance for physiologists so that we can do our service in the community, in the hospital, etc. And I think that is all for this. And you have started this program and for spreading this awareness of clinical exercise physiology. And in your lecture also, I remember you have how you have said ki exercise is actually a medicine, है ना? And you have taught us how to assess the physical activity and how to promote physical activity. I remember very well. And I'm very much proud to say that Dr. KK Deepak, है ना, he was chairman of expert committee for development of fitness protocol. So he from the AIMS Delhi, ex professor and head. And I feel so proud in saying that physiologists are actually contributing to the society. And I wish you all luck to continue this awareness program and to do the service for the people and the patients. So
Thank
steps
you.
are
Thank you
there,
so
like prevention is very important, then promoting the physical fitness, and then using the different standardized protocols, exercise protocols for standardized patients. That is very important. Thank you.
Thank you so much, ma'am, for the insight on CEP. Now I'll welcome our Professor Dr. Avinash Ingle, sir, Professor Physiology, AIMS Raipur, to talk on CEP. Welcome to you, sir. Welcome, sir. As you know, I have already worked as a senior resident in AIMS Raipur. I have worked with sir, so it will be good to hear from you, sir, on CEP, sir. Uh, Sir, can you unmute yourself, sir, first? Dr. Varun, please unmute, sir. Dr. Varun, please unmute, sir.
Yeah, sir has not yet joined, I think. So we will wait for some time.
No, no, Dr.
Okay, so
Avinash
sir
English
has
sir
joined.
has
Okay,
already
yes,
joined.
yes. Yes, yes. Welcome, sir. I have sent the request to unmute, sir. So you have to unmute yourself.
Sir, you can unmute yourself, sir. There is option to mute, unmute, sir.
I was
Please
trying, but it
unmute.
was not. Now it is. Yes.
No, you are unmuted, sir. I think yes.
Hello. Thank you. Thank you,
Yes.
Dr. Gagan.
Sir.
Actually, clinical exercise physiology, I feel not only for the patients, as Dr. Atharva also has said, it is not only for the patients, it is for the prevention of many diseases and also performance for the athletes. Athletes' performance can be monitored as well as increased with help of, for example, CPET. And for patients also, before any event has occurred, or whenever the exercise is being prescribed, or while the fitness certificate is being issued, that time whether the person is really fit or not. At present in India, whenever you might have also has the similar experience, that whenever fitness certificate is given after any chronic disease or any patient with having elements of like cardiac or respiratory disease, so after that event, so fitness certificate is given depending on ultrasound or looking at the ECG or like that. But really, the CPET or whether the fitness test, any test is being done or not. So, in my opinion, usually the patients in India, they don't consider about really the fitness for doing that particular job. I have one experience, like maybe it's one case, like when he was DSP, he was SP, superintendent of police, had a heart attack, so myocardial infarction. After that, he was like given a fitness certificate that he is routine, he can join the routine duties, and he joined the duties with the early morning. They used to have the exercise also. So at that time, he had again the reinfarction and died of this CCF, because what type of exercise he is doing, whether he is really able to join his duties. His duties means how much of work is actually expected him to do, and that's why whether he is really fit to join his duty or not. The duty is not same for all. The exercise during the daily activities is not same for all, and that's why while he issued this certificate, so I feel that time the clinical exercise physiologist must be consulted. So that what type of exercise, what means time, type, frequency, and all. So what type of or how much of energy he is consuming daily. So that also should be considered, which is not happening in our place, and that's why these cases so might be there in most of the events. For one more thing, that fitness test again, at Bombay, there was one recruitment drive for forest guards, and there were around something like 20,000 applicants So they had to screen most of the people. So those who are fit only will be allowed. So that time, 20 people had myocardial infarction during that recruitment drive because they were all made to run, and they were running for their job actually, and that's why that time also, and all had a fitness certificate. So but still this could happen because whether it was considered that how much is his exercise tolerance, that is the main issue. So from my side it is this much. Thank you, Dr. Galan. So
Thank you so much, sir, for the valuable insights, sir. Thank you so much. Now I will ask Dr. The Associate Professor Physiology, AIMS Gorakhpur, to have some side CEP from your side, sir. Dr. Arni Das, do we have you
Hello,
with us, sir?
hello all. Thank you for inviting me on as a panelist in this important
Sir.
discussion. I am Dr. Das from AIMS Gorakhpur. So, as a healthcare professional, we all know actually what is the importance of exercise in controlling NCDs, preventing NCDs, and sports performance injuries, rehabilitations, lifestyle disease. Oh, you all know actually. But my point is, as we see in many countries, is CEP, clinical and exercise physiology, actually formally recognized and integrated with both you can say government sectors, private sectors, insurance sectors, all are involved in that. Now what how can we take steps so that these sectors in India as well give importance, and we can implement a integrated healthcare system where CEP fits actually. This is for my first point. And second point is as Dr. Uditi mentioned in between, we should think about to create career opportunities and jobs in this sector so that more students, professionals should be motivated to adopt this sector as a career pathway. We have learned people from different countries as well. They already set and developed this kind of system in their countries. We can get insights from them in these stages. This is my points. Thank you.
Thank you, sir, for your short and valuable words on CEP. We are delighted to have you with us. Now I'll ask our next panelist, Dr. Sanjay Kumar Subramanian, to have some words on CEP in India. What is the position in doing? Dr. Senthil?
Yes, am I audible, sir?
Do we have Dr. Senthil with us?
Am I audible?
Audible, sir.
Yeah, thank you.
Go ahead.
Sir,
Yes,
I was going with the point of Dr. Aranidas only. We started with the first speaker, our keynote speaker was describing that where to place CEP, and there is role confusion also. So some of the physiotherapists are taking CEP, or physiologists, or who want to do what. That was the problem in India. Indian scenario, that is the first starting point. Or who will be doing the CEP? In AIMS like Institute, pulmonology started doing it, and few like AIMS Mangalagiri physiology started doing it. In few colleges in which sports medicine is there, they started doing it. So there is who is going to take care of it? And there is few colleges there is MD physiotherapy also. So it is like a common field in which everybody can work. So where I look in India, where we can place CEP as a certification rather than a this one, so that all the specialists can come together to come into the CEP. And I think Dr. Nathan will be the ideal person which you have invited. Thank you for that. I think he is the one who they have been involved in setting the standards for CEP. I was going through the document prepared by their team, ICSPP, that they have created the standards going through the 5 major countries, what they have done in the CEP. I think similar has to be there for India, so that we can design a course curriculum in CEP and make it as a certification to begin with, rather than saying other things. Let us begin with a certification with these standards first, and offer to the people who can take it up first. I think ISM is in the very correct position to do that, and you are in the right time. You have called all the panelists for this also who can contribute to this and make this happen. So once that is done and the certifications are happening, I think slowly we can, then certification can solve what Dr. Avinash Ingle was saying. Somebody was not aware how to give a certification for which person. That is the, I think, the problem with the foundational knowledge. And second madam was saying we can contact with the person to have knowledge how to proceed also. I think the certification of this from a standard society like IASM will be helpful for all, will answer all these questions. So I think that's where in India we are lacking the certification. We have to search for certification from America, Australia, and everything. If it is available in India for Indian scenario, then I think that will be the best which you can proceed ahead. I think thank you, thank you for having my points. Thank you, sir.
Thank you. Sit on and next, our next panelist is Dr. Jean Frederick, Additional Professor Physiology, AIIMS. Do we have Dr. Jean Frederick? I think Dr. Jean Frederick.
I'm not able to see him.
To the section. I'll invite Dr. Can you see? Okay. I will move ahead with the next panelist, Rubiti Gupta, Associate Professor Physiology, AIIMS Jammu.
Thank you, Dr. Gagan. First of all, I would like to say that I completely agree with Dr. Senthil on this aspect that we really need a certification program, and I think ISSEM community under the able leadership of Dr. Barun is at a rightful place to initiate real work around this topic so that we have our own Indian certification program in this field. And I would like to bring to notice one particular area which is an often overlooked population, that is the aging women, especially while they are transitioning into the menopause and when they actually go into the menopausal period. Because that is the time when the sarcopenia really advances. Because of the lack of estrogen, there is an accentuated decline in the muscle mass, and even in some form of cognitive decline is really seen. And also in the Indian context, because especially in such kind of women population, there is a lot of sedentary lifestyle. The protein intake in diet is also low, and there are various social restrictions on exercise, which all of which really adds into the declining muscle mass in this age group particularly. And meanwhile, balancing the work and the caregiving aspect of their life, I think exercise is the first thing that goes out of the window. And I really feel that in India, we are in need of awareness campaigns, just like we have for anemia and iodine deficiency and things like that. Especially for this age group, we really need awareness campaigns so that they are educated about the importance of exercise during this period. And also there should be inclusion of some progressive resistance training and functional training regimens so that they can utilize some kind of functional trainings like sitting to standing or even climbing the stairs into their lifestyle in a very practical manner. And we should utilize some screening tools like maybe simple grip strength so that we can detect in our OPDs early such kind of patient population and bring about some change by prescribing some form of individualized exercise regimen to these kind of population. So I really want to put forth this message that sarcopenia is not inevitable. It should be taken as something which can be preventable, and we must take measures in our education system and our awareness campaigns so that we combat it before it really sets in. Thank you so much.
Thank you so much, madam. Thank you so much for your insight. It was very valuable for us. And now I'll invite our next panelist for Associate Professor Physiology, GNLC. Do we have Dr. Harpreet Kaur with us? Going to meet soon, madam, in next HappyCon. Do we have you with us? Okay. I'll move on to our next panelist, Dr. Karthik, Associate Professor Physiology, Umar Karaikal. Dr. Karthik M. Okay. Next, the physiologist Guwahati. Dr. L. Sundeshwaran.
Yes, sir. I'm audible to you.
Okay. Okay, sir. Yes, sir. Please go ahead.
Yes, sir.
Keep.
Right now, we are working on body composition analysis as well as exercise testing lab. And I was hearing the talk given by Dr. Atharva. Yes, rightly, everybody have noticed, everybody have mentioned that exercise is a medicine. But you know, when the patients comes to hospital or a clinic, they want immediate response, or they want immediate treatment, or the treatment has to work immediately. But exercise in that case, it will not work in that way. So even the exercise is the medicine, but in a long term, with the good effort or optimal effort, patients will get benefited. So in that way, I can also ask how those who are having clinical exercise physiology lab already, yes, we need a strict guidelines regarding that. But I am thinking about the hurdles, like how to get the patients and how to follow up the patients. Like even these days, all clinical departments are facing the same issues. They come to the problem, they get the medicines. Okay, initially it starts work. After that, they will not come back to the clinicians as well. Even when we start any kind of exercise training program, initially first week they come. Little when they started to realize little changes, they'll not get back to us. That is how it starts. And then all the regarding the exercise effect on the body, it's all about the trend. It's not about the single data points we have to look into. So, and one more thing I want to mention here is many kind of specializations, additional courses we needed. For example, many of the aids and many of the national importance, they are having lifestyle medicine labs. So, along with the lifestyle medicine and in collaboration with other departments, they can very well start with the clinical exercise physiology lab, provided with the good equipments. And one more thing is, when we talk about the exercise now, it's very much needed for the India, even though we have many programs, for example, Fit India. But the thing is now pre-metabolic syndrome and metabolic syndrome is very common among adults. But somehow by giving many kind of different trainings, we can able to bring them back. But I am focusing more towards the geriatric populations, where their exercise and nutrition and awareness is very much needed for them, rather than adult populations that we can able to. So in that also we can have multiple different specializations, especially for the geriatrics above the age of 55, where even exercise is very much essential and needed for them. Like this is very much evidence when Dr. Atharva showing a 100-year-old veteran World War. The way how he looks and fit, you can compare with the. Not everyone will look at the same, even at this age. So exercise is a very consistent one. And if we created a proper awareness and guidelines with the help of ISSM and other national bodies, we can do wonders in this way. Thanks very much for the opportunity.
sir. Thank you so much for your words. I'll move on with our next panelist, Dr. Tanuj Mathur, Assistant Professor Physiology, JNMCH, AMU. Do we have with us Dr. Tanuj Mathur, sir? You can unmute your. Okay, I'll move on to our next panelist, Dr. Pratibha Rai, Assistant Professor Cardiology, IMS BHU Varanasi. Dr. Pratibha Rai. We have Dr. Pratibha Rai, madam. Next panelist, Dr. G. Sunil Nayak, Assistant Professor Physiology, AIMS Mangalagiri. We have Dr. G. Sunil Nayak.
Hello.
Okay.
Am
So
I,
this.
good afternoon, Dr. Gagan. Am I audible?
Hello. Yes, sir. Yes, sir. Yes.
Yeah.
Well,
Very good afternoon.
CEP. Yes, sir. Yes, you audible,
Yeah.
sir?
Yeah, audible. Thank you very much for inviting me. I thank Dr. Gagan and Dr. Varun for inviting me as a panelist member. Um, what I would like to add here is one thing, important thing which I noted here is being a sports inclined person. Okay, right from my UG days. Okay, I have been through multiple injuries. Okay, I have faced multiple injuries. Then again, I have participated in sports. One thing, maybe all these injuries could have been prevented if I had a sound foundational knowledge of exercise physiology. Maybe that was lacking, and that was the reason why I stretched too much. Okay, I stretched myself too much without going through a proper rehabilitation after the injury. So there was chances of recurrent injuries. Okay, which I faced. Many injuries were recurrent, and I think that was mainly due to the lack of knowledge of this foundational exercise physiology. So I think exercise physiology as such should be incorporated in depth in MBBS curriculum rather than being a specialist course. I think even though it is there, but I think like cardiovascular physiology or respiratory physiology, I feel exercise physiology is not covered in depth in the MBBS curriculum. I think the first thing is I think the curriculum has to undergo a change where there is an in-depth understanding of exercise physiology so that once they finish MBBS, there will be a smooth transition from medicine to a clinical exercise physiologist or a sports physiologist. And next thing is, as we have seen here, we have many overlap of duties, responsibilities between sports medicine, clinical exercise physiologist. We have this physical medicine and rehabilitation department, and also so-called chiro practitioners who are doing all manipulations. So I think CEP, clinical exercise physiology, cannot exist alone. We as a separate specialty. But what it can use, it can merge with and it can supplement the other specialties so that all the specialists come together. It is not only the physiologist who can become a clinical exercise physiologist. I think it could be anybody who has finished medicine, who are really interested. It could be even a nutritionist who is really interested in this exercise physiology, because nutrition is a part of again a rehabilitation, sports rehabilitation or a general rehabilitation. So there is a lot of scope to improve. And again, as Nathan told, it is really disheartening to see that there are very few certification as such standardized guidelines in India. Not everyone can afford to go to Australia or US and get certified in AASC, CM, or maybe in Australia as a accredited physiologist, clinical exercise physiologist. So I think with the help of the abroad organizations or accrediting institutions, I think we can also start something. Maybe though something in the beginning we can start, and I think as everyone noticed that ISM is in a very good stage actually to take up this responsibility, and if we can, in collaboration with the foreign institutions, we can come up with some sort of a certified course so that we all can begin in fact, I can see them many people in the chat room. They were asking, how do I set up access physiology lab? What do we need? In fact, doesn't need much. We need a bicycle ergometer. We need a pulse oximeter, we need a treadmill. All these things are available not only in physiology, they are also available in cardiology departments, other super specialty departments. But though we set up a clinical exercise physiology lab, all we do is we do only the research part. I feel still without understanding the basic, I mean the preventive exercises, we say the preventive management of injuries. Okay, these things are not yet incorporated, and as ourselves, we still are not um, equipped with essential knowledge for running these labs. So I think any certification course or as such workshops, because Dr. Barun is also involved vastly in this field. So where we can come together and get ourselves trained, I think it will help everyone very much so that we can disseminate this information and train the other faculties who are working along with us. So that's my opinion of this clinical exercise physiologist as a specialty. Thank you very much for inviting me as a panelist. Thank you, Dr. Gagan.
Thank you so much, sir, for your insight on exercise physiology. Now, Dr. Praful K. Sir, he is the additional professor of physiology at BB Nagar. So now he is available to take a session like small. He's one of our panelists, so now he's available. So can you unmute yourself and speak on CEP for a couple of minutes? Yes, sir. We can see you, sir. Please unmute yourself.
Can you hear me, Gagan?
Yes, sir. We can
Hello.
hear you. Yes, sir. Go ahead. Yes, sir.
A very good afternoon to all. And at the outset, I would like to thank Dr. Barun, Dr. Gagan, ISS to speaking up from Singapore, and considering that I was in travel, then too they have given me some time to have a word. Thank you so much, Gagan and Dr. Barun. Am I audible?
Yes, you are.
Yes, thank you so much.
You are
Thank you so
audible,
much.
sir. Go ahead.
Thank you so much. First, I would like to begin with saying that clinical exercise physiology does not have as much base as in India as we can understand. During my MD in physiology, we had taken up sports physiology topics, which made us more interested into sports physiology. We had set exercise physiology lab in 2005, which was first of its kind in a very small town of Solapur. After clearing MD, I tried appearing for a registered clinical exercise physiologist, but at those days there were not of resources available. We were not more equipped with all these things, so somehow that RCEP fell back. But during these years, after I had completed with the sports physiology, I was more inclined into developing some things and working on to exercise and sports physiology labs. So the places where I joined later, we tried setting up sports exercise physiology labs. So there are two main hurdles that I can think of. One is there is very less education as such, or very less awareness as such about clinical exercise physiology. Second, there is no dissemination of that education, if so, present to the people who are supposed to be getting it. So what I feel that this ISSME would be a very nice uh, form for us to first formulating a particular body, then formulating rules and regulations for the body, then coming up with various courses or various suggestions that can be made to make some changes in the curriculum which can be incorporated at the level of, say, MBBS or physiotherapy, like that. Third, after these curriculums are developed, maybe go ahead and bring about MD sports medicine or MD sports physiology or MD exercise physiology. These would be the way in which what I feel we can go ahead with. Right now, in our institute, we do not have our exercise and sports physiology lab, but we are working on to getting these exercise and sports physiology lab so that we can start up with our own certificate courses that need to be developed at AIMS. Am I audible? I do not.
Yes, you are. Yes, you are. Please
Yes,
continue.
thank you so much. Thank you
You
so
are
much.
audible, sir.
Thank you so much. Uh, what I feel is this is the correct platform and the right time for us to get together, one, and then begin with the necessary mandatory requirements and then formulating those courses and then begin with the dissemination of it. As of I can understand, clinical exercise physiology not only is just an exercise what can be prescribed as a medicine, but it has got a wholesome approach or a holistic approach that can be given to any individual, be it a patient, be it a normal individual, be it an athlete, be it a sports person. We can utilize this exercise as a medicine or exercise as a tool to bring about a well-being into that particular person. So it is not just one aspect, but we have got many aspects that can be looked into for exercise, which can be given for any individual, maybe be it for prevention, maybe be it for rehabilitation or as a treatment. So what I feel is this exercise itself or exercise physiology itself or exercise medicine itself is a vast branch. Maybe we can go ahead and develop individually first and then disseminate it to all the people below. Sorry, am I audible? Thank you. Thank you.
Sir, you are perfectly visible and audible.
You are, sir.
Thank you, ma'am. Thank you. Thank you so much.
He's in
Lastly,
Singapore, actually, sir. In Singapore. Thank you very much for your time and insight, sir.
Thank you so much,
Yes, sir.
Gagan.
Yes,
Thank
sir.
you. I would like to conclude by saying that if we are working in physiology, might as well we try collaborating with other institutes outside India, which will help us not only just guide and frame many things, but it would help us implement many things at our own levels as well. So that is what I feel. This is the passion that we should be having for developing exercise and sports physiology in India as a whole. I would like to thank once again and everyone for being so passionate about exercise and sports physiology. Thank you, guys. And all the best to the team ISSME.
Thank you so much, sir, from your busy schedule time. You are in an airport time to your insight. Well, sir, can we say?
Thank you so
Thank
much.
you.
Thank you. Thank you.
Our last panelist, Dr. Tanuj is available. Please unmute yourself, sir, and give us your insight on CEP in India. You can have Dr. Tanuj Mathur. If any panelist speak on something, please unmute yourself and speak, sir. You have a couple of minutes. I think all have already discussed CEP and gave their insight on CEP. Now we can move on to a couple of questions, then we'll finish it off and end this session. Do we have Dr. Atharva Dole? Are you online right now?
Yes, I'm here.
Yes, sir.
Sorry.
Yeah, sir. Question was asked by a participant is like, what may... yes, sir. Can you hear me, sir?
Yes, sir. Yes, sir. I can hear you.
Can you hear me, sir?
Yes, sir.
Now
I can
I'll
hear
ask
you.
question, sir. The question was asked by one of the participant is, yes, a possible SOP for the doses of exercise for the regulation of metabolic disorders, hypertension, glycemia, dyslipidemia. So what is the possible SOP for prescribing the doses of exercise?
Okay, so I think your voice broke a bit, but if I hear it right, they just want to know the protocol possibly for hypertension or hypoglycemic conditions. So essentially, the important aspect to consider
Yes,
here
correct.
is prescribing a good intensity resistance training. So there are multiple evidence that shows resistance training gives you great benefits in terms of hypertension. Obviously, there are a few things that to keep in mind. So yeah, trying to just avoiding the Valsalva maneuver, so which is a contraindication for hypertensive patients. But overall, if you prescribe a good resistance training exercise program, it will give you certainly good benefits in terms of these conditions.
Okay, thank you so much, sir, for the question.
Doses are
Now I'll
subjective. Doses are
Mr.
subjective.
Nathan. Yes, Dr. Archana, ma'am, wanted
Exercise
to
doses
add.
are subjective.
Madam, please go ahead.
Varies for person to person or the subject or the patient.
Yes,
So
certainly, ma'am. You're absolutely right. All
at this
depends
platform,
certainly
we
on
can't
the.
say. Uh,
Sorry.
at this platform, we can't say anything like how much exercise or which exercise because everything is subjective.
Yes, definitely. Everything is subjective, but it depends on rightly you said. It depends on the patient's goal and patient's objectives of what they want to do. But ACSM, the American College of Sports Medicine, have given specific guidelines about prescription of exercise in terms of resistance training. So, if I were to speak in terms of hypertensive patients, I think the prescription is about 60 to 70% of their max heart rate. So, where we can prescribe cardiac exercises, and in terms of resistance training, they recommend about 8 to 10, 6 to 8 about for on the RPE scale for resistance training as well. So it's like you rightly said, it's subjective. Definitely, it depends on what the person's capacity, and we can definitely prescribe the exercises after we have done a thorough assessment about how the person's strength is, and then we can definitely prescribe exercises.
Target heart rate and maximum heart rate for aerobics.
Thank you. Excuse me. Am I audible?
Thank you so much, Dr. Atharva Dole.
May I ask the question, please?
Madam, you are audible.
No,
Sir, please,
Myself, Dr. SK
please
Singh.
put
May I ask
the
the
question
question, please?
box. Sir, who asked the question? Am I audible, sir? Hello?
Yes, audible.
Sir, you can go ahead with the question. Yes, sir. Sir, you can ask the question. Okay. I'll move on to next question from one of the participant. It is for Nathan Reeves. Mr. Nathan Reeves, can you hear me, sir? Mr. Nathan Reeves, can you hear? Okay, this question is for you, sir. Nowadays, with all the wearable devices tracking heart rates level, do you think clinical exercise physiologists will move from just giving general exercise advice to creating personalized exercise plans based on real-time data from these gadgets. They want stability of these gadgets.
Thank you. Thank you for the question. And certainly we're in a very exciting and potentially daunting phase of the rise of technology, artificial intelligence, tracking devices and technologies as well. I think that these technologies should be embraced by clinical exercise physiologists to assist them in making more precise decisions. But I am very confident that certainly the skill set and the clinical expertise of exercise physiologists will not be superseded by these changes in technology. We'll still need and require skilled practitioners who can consider, and as I made reference to in the chat response just there, can make reference to the clinical guidelines and position statements that underpin many pathophysiological domains, and be able to nuance that specific to the patient and the client that is actually sitting in front of us. There might be a very generalized set of guidelines around aerobic exercise, resistance exercise, strengthening, stretching exercises and balance exercises, but unless that can be contextualized to the client or the patient where they currently are in their particular journey, then they won't be in a commit to the exercise and be able to maintain that really important compliance with the intervention over time.
Thank you so much for the response to that question. I think we have already exceeded the time limit of our session, so I wanted to conclude this session, and I wanted to thank Dr. Atharva Dole for giving us, sir, Mr. giving us time, and all the exclusive panelists of this session, like Dr. Singh sir is there, Archana is there, and all the panelists from all over India. I want to thank you all. And I wanted to thank Indian Society of Sports and Exercise for conducting this session. It was very helpful for all the participants. And for the onwards, I want to tell that we are at CCM. Basically, we are going to course on the CEP certification, clinical exercise physiology, soon. So many participants asked about the courses in CEP in India. So we are going to start. So in that, I to end the, and I wanted to ask Dr. Varun if you wanted to say something. Please go, Dr. Varun.
Yeah. So I hope you can listen me. Yeah. So I have been listening to all the presentations and all the questions that they are very interesting, and I will again appreciate thankful to the of our society, Indian Society of Sports and Exercise Medicine, Professor Dr. Domin, and also like to congratulate and thanks to Dr. Gagan Banodhe for moderating this session very well. And again, Mr. Nathan Reith also for coming, for sparing time and coming and sharing some of your views. Very important in India, where we don't have CEP as such. And always, Dr. Atharva Dole, I'm very thankful to you because I have known you for some couple of times, and I know that you have been working very well in your clinic, and and thank you for your sharing all the pathway how you have achieved, the certification and expertise in CEP, because CEP as such in India is not there, so it is required. The pathway is required. And also to all the panelists here, including all the professors and senior, faculty in physiology, cardiology, and other specialty. Thank you for sharing your views. And before ending the session, I just want to say, appreciate my my lab mates, that is Dr. Sankalp Jha and Dr. Ashish Kumar Gupta. They were the one originally who planned everything. But there is a health camp going on, and from the Department of Unit of Sports and Exercise Medicine. So they have gone there to contribute in the health camp. So they are actually in the health camp, seeing all the patients and everything. So they could not join the session. So I requested Dr. Gagan at the last moment, and he kindly agreed to moderate it. Although I was also present the whole session. So, so I think we have done this session in the way which was expected, you know. And again, from Indian Society of Sports and Exercise Medicine, and from from our side, from our lab side. So I just want to say that hopefully in the future we are planning to launch the CEP training program, because if you scroll all the questions here in the YouTube also and here also, you can always see the question focus around the training, because physiology training as such in India is limited patient exposure is there. So this is the fact which we have to acknowledge. And since patient handling is not a part of this thing, so theoretically we may have learned lots of things about exercise as a medicine, but when you see the actual patient, when it is time to actually do it, when it is time to actually prescribe the exercise, so that's a little bit difficult. That setback is there. So hopefully that setback will be removed after we introduce CEP training in India. And I'll request Dr. Atharva Dole will be joining our society. And under our society, because Indian Society of Sports and Exercise Medicine is a collection of an umbrella body of lots of specialty in different domain related with exercise and lifestyle and health. So under our domain, we will be creating a focus group of the physiology, sports and exercise physiology. That will be our first step. Because lots of, I think around 70, 80 members of our society, they have physiology as a primary specialization. So that's a good opportunity for everyone. And recently, a few of the members must have seen the first national conference of the dental wing of the ICM. So under the ICM, we have separate individual autonomous wing. Autonomous is very important. We decentralize the power so that awareness can be done in a relatively independent manner. So the dental wing of the ICM has with its own director is the equivalent to the president, secretary, treasurer. They have their own everything, and they have launched their own national conference in Pune upcoming. In a similar way, I request all the physiologists, or all who are interested in physiology, all who are interested in clinical exercise physiology, who are the member of ICM, please make a group. We have already have a WhatsApp group, but you can organize yourself as president, secretary, treasurer, or something like that, so that the work can be done. Like, for example, we can do different type of the CME, CME, or any kind of the workshop, any kind of this thing can be done. And similarly, we are also in a pipeline under our president. We are also trying to take the membership of the international body. I think we will do it within this week only. And after this membership, we will directly requesting Mr. Nathan Reeves to please guide us in how to formulate different set of standard on how CEP should be taught and should be trained. So that we will be doing. And then after some time, what we will do is we will launch an educational program. First is this one where a webinar is created. This is just a simple webinar, but we didn't expect that the participant will cross around 800 because we have just started the advertising few days back, but it is a very positive sign. So after this webinar, it may take, let's say, 1 month or so, we will plan a whole day CME program where I will request Nathan and some of the international speakers, so that they can contribute, what exercise physiology is being taught or being trained in different countries. So that we will plan in a few coming weeks or months. Then after that, a physical session, we will plan a physical session. A physical session, it may be a workshop or it may be a seminar or something. It can be done at the BHU Banaras, where I am stationed, or it can be done elsewhere. So if any of the physiologist member, senior physiologist member of ICM are there, if you are interested, then please take this issue up. And also we have to choose some representative among the physiologists. Like, for example, Atharva Dole will always be the first one, because since he has trained under Nathan and he is a qualified CEP, so we will request him to take the lead on how we are going to formulate different curriculum and everything. And he will be the connecting link between Nathan's and our society. So that is how we plan to go ahead. And in the future, we will launch a short program on CEP, theory plus practical. Then after that, certification program also we are planning to do it. And hopefully we will be, launching this CEP in India very soon under the leadership of our president, Professor Dobson Dominic, and also in collaboration with the Nathans. So that is what I want to say. So if any kind of any panelists, senior panelists are present here and who have not yet spoken, then you can speak, you can unmute yourself and speak one by one, because we have still a few minutes or 2 or 3 minutes, then we can close the session. So thank you very much for everyone for joining us in this Sunday morning. So we'll wait for 1 to 2 minutes if there is any any senior person here available. You can unmute yourself and let us know.
Dr. S.K. Singh wanted to ask a question. Dr. S.K. Singh, do we have Dr. S.K. Singh?
Please allow. Yeah, please allow Gagan for a few times, because lots of I could see lots of this thing.
Can I speak?
Lots of people are.
Yes.
Please.
Yeah. Hello, I am Dr. Supriya Gupta. I have retired from Vardhaman Mahavir
Yes, madam.
Medical
Go ahead,
College.
please.
Am I audible? Am I
Yes, please
audible?
go ahead.
Yeah.
Yes, please.
And in our workshop there, I had met Dr. Varun. So I got interested and I enrolled in this webinar, and I found it very, very interesting. So I was only thinking, now I am heading the physiology department in Sharda University, and it has got 14 colleges and lots of youngsters who might be very much interested in sports, something little scientific approach to sports. So I was wondering if we can do some kind of a workshop or some CME or something in which, not only limited to medical college, but if we can have the other students as well, then that would be a good idea.
Yeah, that definitely we can do, madam. We will already. I have already shared that we are planning to do some workshop or something on CEP, because we want to introduce CEP all over India in different places. So thank you, madam.
Thanks to all. Thank you so much. Great topic. And Dr. Barun is very encouraging and motivating for us always.
Hello,
Thanks to
everyone.
Dr. Atharva Dole, and thanks to Dr. Mr. Nathan Reeves and all the panelists for joining us, and special thanks to Dr. Varun and his team, Dr. Sankalp and Ashish for organizing this. Thank you.
Thank you.
Hello. Yeah, hello, everyone.
Thank
It
you.
was a
Thank you. Thank you.
Can you hear me my voice? Hello.
Yes.
Yeah, this is.
Yes, I can hear
Want
you.
to say something?
This
Okay,
is
okay, no
Dr.
problem.
Arun Shah from
Someone is.
Nepal.
Okay, please.
Yeah,
Please, sir.
thank you for panelists, and it was a great session. I'm into like sports medicine, like a sports injury, orthopedics, a sports injury. So I want to, if there is any collaboration, like we can do from Nepal or some other organization, like some research lab or something like that of kind. I'm ready. Like, yeah, I have mentioned my email ID and my WhatsApp.
Okay.
Yeah.
Okay. Thank you very much for. Yeah. Sure.
And thank you.
Yeah.
Thank you
Absolutely. In
for
India,
the
sportsmen. Yeah.
yeah, great
So
session.
I will request Nathan, if your CEP is not there in Nepal. Nepal is a neighboring country to India, so you can always connect with sir, so that CEP is there. And from our side, Indian Society of Sports and Exercise Medicine, also we can always collaborate with your association. In India, sports medicine is basically three specialty are required for sports medicine, apart from a core MD sports medicine, that is orthopedics, PMR, and physiology, the clinical physiology. So these are the three main specialty for sports medicine apart from sports medicine. So we have lots of our members who have done, who are qualified in sports surgery also, sports injuries also. So as a society, we can always collaborate with you, and you can always write to us, our website, and also in the Facebook and everything, our page is here. So happy to collaborate with you.
Yeah. So how you differentiate like exercise physiology and physiotherapies?
Yeah, that's what's beautifully highlighted by Dr. Atharva Dole. And he basically highlighted 3 points. That is how to differentiate between a personal trainer, a physiotherapist, and exercise physiology. If Dr. Atharva Dole is there, then he can always highlight that. Or you can always chat with him later. Atharva Dole, can you please post your social media handle also, like Facebook or LinkedIn or everything, so that the people can connect you.
Okay.
Atharva Dole is, I think he is not there. So let me answer this. The Nathan is also there. So Nathan, please, you can answer it. Then I can supplement.
Sorry, the question is the difference between physiotherapy and clinical exercise physiology. Is that the question?
Yeah. Yes. That's
Yeah,
it.
lots of physiotherapy they introduce as exercise physiology in our country. So it's mix up. So how we can distinguish a separate branch like physiotherapy and exercise physiology?
Okay. Let me first say that this is not to India. There are many countries around the world that continue to work through this question, the key differences between a physiotherapist and a clinical exercise physiologist. I'm going to generalize here because in some circumstances this response might be relevant, and in other circumstances it might not necessarily be relevant. But primarily, exercise physiologists use exercise as their chief modality to provide assistance to their patients, as distinct from physiotherapists who have a multitude of modalities that they might be able to deploy to assist clients. Generally, around the world, clinical exercise physiologists are more highly trained in being able to deliver physical activity or exercise as that intervention. We also do it through the lens of lifestyle modification, considering a biopsychosocial approach when it comes to the intervention as well. It's one thing to develop or prescribe exercise. It's another thing to support a patient or a client to understand why they're doing their exercises, how it's going to assist them physiologically, psychologically, and to assist them in developing the requisite skills and abilities to self-manage in this area. there are many examples where a physiotherapist's scope of practice does cross over with a clinical exercise physiologist scope of practice. And there are in my country and around the world. So it's a little bit complicated to completely disconnect the two. In an ideal situation, physiotherapy practitioners treat and interact with patients in an acute presentation where there might be a need for hands-on intervention to assist in the management of that acute presentation. And then they would refer on to a clinical exercise physiologist where there is a subacute or chronic need for, again, exercise or physical activity intervention, lifestyle modification through that particular biopsychosocial approach. How did I go with that response, Artie? It's always a tricky question to answer, isn't it?
Yeah, thank you,
Yeah.
Nathan.
Yes, Nathan, I think you were spot on, and it's a very thin line. And like I said, it's many a times, even in Australia, it's a pretty much an integrated approach where in a hospital setting or in a clinical setting, both work together. And so, yes, like I said, many times in India, even I'm confused with a physiotherapist, and there is a need to educate and just be aware about what specialization or what kind of skills that I bring to the table, and just to prescribe exercises in a safe and effective, which is evidence-based exercise programs.
Yeah, that's great. That's great. So, is there any senior panelists who want to ask anything, or should we conclude the session? Because lots of questions are there, so I cannot answer all of them. So you can always connect to us in different social media platforms. So you can always ask us, so we can discuss
Hello.
the interesting letters also.
Dr. Barun, my voice is coming?
Hi. Yes. Yes, please, sir.
I want to convey that if we see the syllabus of physiotherapy and physiology, we can very well have the idea what is the difference between them. If we go through the syllabus of physiotherapy and physiology, in particularly exercise physiology, then we can have the idea. Thank you.
Thank you. Is there anyone who want to say something? So let me check among the panelists. So I think we have spent a couple of hours today, and it was a very fruitful discussion. So I would like to conclude now. So once again, I am very thankful to the speaker, the main speaker, Dr. Atharva Dole, for sharing all the detailed information with us, and also the Nathan who have joined us from Australia, right? I believe from Australia. Yeah. So sharing, and in the future, I hope that we will see, a clinical exercise physiology as a reality on ground. That's where we hope. So thank you very much once again. I am Dr. Varun Sharma, and I am representing my lab with Dr. Sankalp Jha and Dr. Ashish Kumar Gupta, and from Indian Society of Sports and Exercise Medicine, representing our president, Professor Dr. Dominic, Vice President, Dr. Kiran Kumar Kulkarni, the Joint Secretary, Dr. Shikha, and Media and Protocol Head, Dr. Is there a problem here? Network problem is here. Okay, can you hear me? Okay. So technical glitch was there. So from all the senior members from our society, we thank everyone, and thank you. So I'm closing this session now. Okay. Bye to all. Thank you. Bye.
Bye, sir.
Bye.
Thank you for session.
Thank you.